By 2050, it's estimated that 1.1 million of us will suffer from dementia. 1.1 million. Putting more stress on our healthcare system and also on the families and friends of those who watch their loved ones suffer and take on the burden of caring for them. So tonight we're going to have a look at what we know about what causes dementia, what we're learning about how it can be prevented, and also the best ways to look after those who are suffering from it. To help us out tonight in studio is Professor Peter Schofield, the Executive Director and Chief Executive Officer of the Prince of Wales Medical Research Institute. He's involved in research into the genetic causes of dementia. Good to see you, Peter. And also with us tonight, our second guest is Dr. Clement Loy, who's a neurologist at Westmead Hospital in Sydney, and also a senior lecturer at the Sydney School of Public Health, University of Sydney. Good to see you.
Thanks for having me.
Okay, where to start with this? It's bigger than Ben-Hur. Professor Schofield, can you just put it simply, what is dementia?
Tony, dementia is losing your mind. And that's literally what the name dementia means, out of the mind. So that's something that we can see with somebody in our family, that they've lost some of their cognitive ability, that they can't remember, that they can't do normal tasks. This is much more than I've forgotten where my car keys are. This is actually not knowing the names of family members. This is not actually recognising common things in the kitchen to prepare food or the like. So as the illness progresses from its initial presentations, it becomes profoundly disabling.
Peter, they often say that if you think you've got a problem, you don't have a problem.
I think that's probably fairly true, actually.
I mean, is there a clear difference between getting older and having a bit of memory loss and developing what we would term dementia?
So age-related memory decline is in some sense what happens in our brain as we see happening in many other parts of our bodies. As we age, we suffer osteoporosis, our muscle strength drops off, and so we have a level of decline, cognitive decline, as we age. But that's, relatively speaking, mild, and not in that way profound. It's often thought that mild cognitive impairment, the early stages, is actually a prodrome or a pre-marker of what goes on to be dementia.
So it's okay to have senior moments?
A senior moment's okay. A senior hour or a senior day or a senior week or a senior month is definitely a problem.
Alzheimer's obviously is the most common type of dementia. What other types are there?
Well, there are many, and they progressively become rarer and rarer. So, as you said, Alzheimer's is the most prevalent cause of dementia. Other types are caused by vascular symptomatology. So, basically, the arteries that feed the nerves in the brain clog up, don't work as well. The nerves basically starve. So that's actually a more treatable form of dementia. Frontotemporal dementia, named because of the parts of the brain that degenerate, but also characteristically gives behavioural and language problems, dementia with Lewy bodies, and so on and so on. The list goes on. Whilst there are clinically differences in the way each of these conditions presents, the paramount issue is that they rob the individual of their personality.
Understood. Clement, what's the experience like if you're a person diagnosed with dementia? What's happening to you, and how aware are you of the problem?
Yes, that can change through the different stages of dementia. Often in the early stages, there'll be a lot of frustration, realizing your loss of capability. There might be a lot of depression or sadness, which can be treated and often would improve someone's function substantially. As one becomes more advanced in dementia, often people would lose some insight. So then the burden and the difficulty actually is more experienced by the family. And towards the end stages, obviously, there'll be a lot of care issues.
Are there cases of dementia that begin as mild and stay mild?
Rarely there are. The most common type of dementia, that is Alzheimer's disease, tend not to be like that, but there are rarer sort of causes that can progress that way.
So most cases,
Unfortunately.
95% will progress.
Yes.
How likely are we to get it?
Yes, so as you pointed out before, by the age of 85, about a quarter of the population would have some kind of dementia.
Have we noticed an increase as the years roll on? I suppose the fact that we're living longer probably raises the numbers anyway.
That's right. So age remains the most important risk factor for dementia. So looking at our population right now in 2010, about 15% of the population is over the age of 65. But when we come up to 2050, then almost a quarter of the population will be over the age of 65.
And this, of course, becomes a huge mountain for the medical system, doesn't it? I mean, the need for support is going to be huge.
Absolutely. Access Economics estimated by 2060, dementia would be the most resource-intensive single medical condition for the health system.
It's extraordinary, isn't it? Peter, in some cases, patients with dementia can become aggressive and even violent. What's going on in those cases?
I wish we could give a clear answer to that, but you're absolutely correct. The behavioural symptoms that present in a number of the types of dementia, Alzheimer's, but also the frontotemporal dementias, can present really quite profound management challenges. Profound challenges for the partner if the individual's still living at home, because their husband or wife is now becoming uncontrollably violent. And it's not that the person is wanting to be violent, it's the way in which the illness is affecting the circuits in their brain.
It's just the inhibitions are disappearing, aren't they?
In the frontotemporal dementias in particular, there's a lot of disinhibition, so a lot of inappropriate behaviour, which may or may not be violent. And there's, to be honest, there's really very few overt clues as to which person would go on and develop those sorts of problems.
Is it likely to be a temporary state, or people who develop that violent line will go on to continue with that problem?
Many people go through a period of that behaviour. Unfortunately, the behaviour tends to disappear as a problem as the dementia itself becomes more profound. So it's not a very satisfying answer to the problem going. There are reasonable ability to control some of the behavioural things through medication, but I think it's probably fair to say reasonable rather than good.
Clement, what do we know about the role that genes play in determining whether we're likely to get dementia?
Yes,
is it genetic?
Yes. So it's a complicated question. So a very small proportion of people with dementia have a single genetic mistake which causes dementia. But that remains less than 1% of all the people with Alzheimer's disease. In the larger sort of group, then there are common changes in the gene that increases someone's risk of having dementia. For instance, if one of your first-degree relative has Alzheimer's disease, then your risk is slightly increased by about 2 times.
So mum and dad.
That's right. And that's compared to the very unusual cases where there's a genetic cause of Alzheimer's disease, then your risk of getting dementia will be 50%, which is a lot higher. But most people will be in the low risk category.
Sure. I mean, are there any other causes we know about?
Yes, there's now quite conclusive data to say that if someone has got a very substantial brain injury at some stage from accident or trauma, that increases the risk of developing Alzheimer's disease.
We often talk about mobile phones and the fact that we've become a mobile phone culture. Any indication that overuse of the mobile phone could be a contributing factor?
Well, clearly mobile phones have only been around for a number of decades, and
so we won't know that for probably another 15, 20 years. Yes.